Our conversation with Indiana Regional Medical Center President and CEO Steve Wolfe is presented by Marcus & Mack, a law firm representing injured people. Steve, good morning.
Hey, Todd. How are you today?
Wonderful, wonderful, and it's good to hear from you.
Good to hear from you. Always good to be with you.
Well, when we think about the way the last three and a half months have gone, there's been so much uncertainty happening around, but Indiana Regional Medical Center has been a focal point of it all, and so I was looking this morning at one of the initial releases that you put out about guidelines and how things were going to be moving forward at IRMC, and this was at the very beginning of the pandemic restrictions. As you look back at these last 3.5 months and how things have moved and progressed, I would guess that you'd have to be pretty satisfied with the way that IRMC responded.
I really can't express in words just how incredibly proud I am of the dedication and the courage and the sacrifice that the staff and the physicians, everybody had. I mean, it really was incredible, with all the attention to this COVID-19 around the world. People couldn't help but, be apprehensive, and there was a disruption in the supply chain, and so, you're scrambling to provide, the best protection for patients and employees. And it was just a very, very, challenging time. And people really stood up really strong and really responded, and just couldn't be more proud of the effort in terms of that. I think we were blessed in that, it came a little later to Indiana County, and I think we had a little more time to get some protectionary measures in place. And the residents of Indiana County really have been incredible, as always, in terms of attempting to do their best. And so far, Todd, it's gone better than expected, although I don't know that we know for sure what's around the next corner.
No, that's true. Well, that brings me to my next point. We were told at the time that every single day you were having meetings, reviewing what you were doing, making sure that it was right, making whatever modifications needed to be done. Does that review process still go on a daily basis?
Yes, it does. We do have a COVID task force that meets daily. The agenda has become a little thinner, but you'd be surprised. There's lots of things to be talking about in terms of testing and surge planning and just different issues that are coming up. But we continue to be, I guess, optimistic that things have gone, so much better than expected, but also concerned that, as we do turn green, that people remain vigilant. Just, common sense measures can go a long way. And so we'll see. You do get some reports of some states and countries around the world that as they've reopened, that they've had, increases. We want to stay green and not go backwards.
Well, one of the things about that is you use the word vigilant, and it really is the case. People, the general public, we need to be vigilant still. We can't let our guard down a bit, and I know that's the case at IRMC. You're not about to, are you?
Yeah, they've continued to take, incredible precautions, provide all types of personal protective equipment. The cleaning techniques and everything are superior to really anything locally. And we believe Indiana Regional is a very safe place, and that, we continue to remain vigilant out there. And for those who have been, afraid to get care, we recognize that for those who are most vulnerable or of certain age, that they want to be, safe, and we want that to be too. But I think through this period of time, we've realized that there's a cost to not getting care in people's health as well. And so people should feel, able to be able to come out and receive care in a safe manner at the Indiana Regional Medical Center, physician office, or whatever testing you might need.
We have talked with a number of physicians and nurse professionals from IRMC, Dr. Shannon, Dr. Clark, Dr. Balewick, about the fact that with IRMC now fully functioning with every one of the medical services that you have always offered, some of those had to be curtailed a little bit, but now everything is back operating in full swing. that yes, there are changes to be made, but in the bottom line is this is a safe place to be, and probably as safe as any, because you're right there with the medical professionals who are going to help you if you have problems.
I think absolutely everybody is, on their A game every day at Indiana Regional. We basically have viruses in the hospital, a good majority of the time. We're used to working around those and, doing what we need to be safe. And we are, even accentuating those to the highest level. We do believe Indiana Regional Medical Center is a safe place to come and seek care. People certainly need to make up their own mind given their circumstances, but I think there were too many stories of people foregoing care because they were afraid, and that should not be what is going through people's mind at this point in time.
Yeah, Dr. Clark made that point very, very well, saying, the heart attacks still happen, the strokes still happen, and those are things that you don't want to mess around with. You want to get that taken care of right away. Don't put off those procedures because you could be buying yourself some really dangerous health outcomes if you do something like that. So policies being adjusted all the time. One of those policies has to do with visitation. Right away, there were restrictions on visitation and just making sure that everybody was safe and was protected. What is that policy now? Folks are wanting to know, can we come to the hospital and visit patients?
Yeah, the COVID task force did allow patient visitation to begin Monday at noon. You're allowed one visitor per patient per day. We really agonized over, stopping this. Need the love and care of loved ones when you're in the hospital, and it was a very difficult decision. But really everybody ended up doing that, and we followed suit. But we're happy to be able to reverse that in some way here and provide that new policy.
Yeah, it has to be a great help to those patients to know that they're not isolated and away from their loved ones, and someone can at least be there with them in some pretty, tense times for them in terms of their health. And so that's a good thing. As IRMC has gone green, that's one of the things that folks can look forward to is a little bit of an expansion of visitation policy. What does going green for Indiana County and the region mean for IRMC and the way that you conduct business every day?
Well, I believe that, we're running at full capacity in terms of all the services that are provided are open and available to the public. That, I believe going green gives confidence to the community that, the virus is in a certain stage where there's confidence to allow people to move around and continue to use common sense measures. And that, we've definitely seen the hospital really return to an semblance of normal over the last several weeks, really starting with the resumption of elective procedures and outpatient testing and moving to the yellow phase. So I think green is really just another extension of that in terms of that. And so I think everybody is excited to be able to get out and move around and do some of the things that they've always wanted to do during these last months where they've restricted. And so we know that's good for everybody in terms of how they're feeling and thinking, and that's important as well. Just to encourage people to remain vigilant, and we want to stay green. That's the main thing.
Had to make you feel good when we had like the COVID Avengers, the kids that were providing the PPE, and so many others have been out there recognizing that the folks who have been on the front lines of this COVID-19 battle are the people who are most in need of support. And the community has really turned out in support of IRMC, have they not?
I would say that you can't really represent what those acts of kindness and generosity meant. It was, a very difficult time. I mean, it still is. People are, very vigilant and working, but as this was starting to roll out, I mean, the acts of kindness and generosity from the community that are really too many to enumerate on this call because I'd miss people, but, the parade that they had, the various things that were donated, the food that was given. Those things really made a big difference. You talk about small things matter. I mean, they made the difference and made people feel like they knew what they were doing was making the difference, that people were counting on them and that they were appreciated. Indiana is a great place to live and work, and we were really recipients of that outpouring during this time, and we thank everybody.
Yeah, I really can't enumerate just how much it must have meant to somebody working in the healthcare field, knowing the uncertainties of the time, and there are still many, many uncertainties, and yet to know that there are people who recognize that and know that the risks that are being taken by healthcare workers really points to the fact that it's a special group of people that you have there at IRMC.
I can't tell you the number of people that reached out, really from across the county and the region and even the state, and some people from around the country. I mean, everybody recognized that the healthcare professional in the hospital was really in the front line of this, and that their thoughts and prayers were with us, and we thank God for that.
Any truth to the rumor that Steve Wolfe, in the most difficult of times, offered to perform surgeries but was told that instead, here's a mop, go down to the third floor?
We would not do that to anybody. I'm just a pharmacist, and I'd be pretty bad at that probably today.
But it does really point to the fact that there are a lot of people who had to take extra measures and learn some new things at IRMC, and you did it. And the hospital continues to perform well. There have been all kinds of concerns that have been expressed about the viability of rural hospitals such as IUP, especially in this environment, without those elective procedures, without the funds coming in that are needed to be a valuable part of the community. So, last question for you this morning. What's the footing like today? You feel pretty stable?
It was a shockwave to the industry, and to really stand down really all elective, non-essential procedures and testing, and then really not have any significant COVID cases. And we're grateful that we didn't. I've talked to counterparts that lived through that, and it was ugly. So we're grateful that we missed that, but I mean, it almost ended up being kind of a perfect storm of, I came to the hospital every day for close to 2 months, 7 days a week. And you go in front of the parking lot and it'd be like no cars. It was just incredible. Our revenues were off, really, 58% in the month of April, compared to February. So, it really did create a big financial challenge, and obviously Indiana Regional had to respond. And I recognize a lot of businesses were impacted even greater than us, and our hearts go out to them and hope that they can get reopened and get the assistance that they need to continue. But, a 58% decline in revenues was huge, and we're working our way out of that, and that's not going to be overcome in a short period of time. But I can tell you that May went a lot better. Like I said, we definitely saw a sense of normalcy, and we're seeing several of the service lines go back close to normal levels. Some are a little slower. So we will get through this and continue to keep Indiana Regional Medical Center an independent community hospital. There's less than 8 in the state that are over $100 million in size, and we think that it's important, and we're fighting to keep Indiana owned by its own community and not controlled in a tertiary care center or a for-profit out of state. And so we're continuing to fight that, but it's going to continue to be a challenge.
It is. It's a battle well worth fighting, though, and we appreciate the fact that you've been able to take some time out of that battle to spend with us today. Steve Wolfe, thanks so much.
Todd, always a pleasure. Thank you for having me.
Our pleasure. Our pleasure. Have a great day today.
You too. Bye-bye.
Bye now.
You too. Bye-bye.
Bye now.
You too.